Welcome back to AZH Wound Center for part 2 of our two-part series. Again, we're joined by Miss Sharon Baranoski. Most of you know her as being the author of Wound Care Essentials. Hello, Sharon.
Hi, Jeff. How are you? Thanks for having me.
You're coming out with a new edition of the book?
Yes, hopefully in December of this year.
Fabulous.
We'll have the 5th edition out.
We're all looking forward to that. So I shared this patient with you a little earlier today, presented with a plantar ulcer from diabetes, and then a secondary diabetic foot ulcer, which she took a stumble at home and was put in the hospital.
Yeah.
I've shared that debridement with you. What I would like to share is some technologies that we're working with right now. We have some exciting technologies. One of them is the tissue imaging with near-infrared spectroscopy. It's called KEN technology.
Great.
The other thing that I'd like to share with you is a new technology called DermaPACE. It's an acoustic therapy for treating tissues, and we're going to do two things here. It's indicated for diabetic foot ulcers, but we've been looking at it in other applications, and we're going to treat this young lady's, both of her diabetic foot ulcer as well as the pressure ulcer, and see if we can get some improvement. And then we're going to shoot the KENs pre and post, see if we have any changes in perfusion. So Jonathan's one of our technicians. I'll let him quickly describe the KEN technology in 30 seconds or less.
So the KEN snapshot technology is near-infrared spectroscopy imaging, which basically means we're taking a picture of the wound or body area, body part, with near-infrared spectroscopy. And what that does is it allows us to measure the deoxygenated versus oxygenated hemoglobin in whichever body part we're imaging.
Very good. Okay, John, show us how that KEN imaging is accomplished. It's very quick, isn't it?
Yes, it is. So we start out with calibration. We previously did that. So we're just going to show the imaging study. So we're going to center the wound with the camera and take a snapshot of that.
Very clear pictures they take.
Nice.
Wow, yeah, that's
So we're
good.
actually seeing the perfusion here now. As you'll notice, this is her prior area of skin graft, and as you would imagine, it's not as well perfused as the normal tissue. It's kind of interesting, and there's her ulcer. So we'll go ahead and treat this with DermaPACE, and then we'll compare it again. John, why don't we go ahead and get a shot of the pressure ulcer? Okay, good.
Yeah.
So here we see, there's a hypervascularity and obviously increased hemoglobin saturation in the area, but the ulcer, where we see that dead tissue, you can track that. That's pretty densely. The thing I like about KEN image, Sharon, is you can actually touch it, and you can get a value of saturation right in the center, 21%.
21%.
That's not real
Wow.
healthy, and that
Yeah,
correlates
no.
with the tissue characteristics that we're seeing, the dead necrotic tissue.
That's
All right, John,
great.
go ahead and explain the DermaPACE, and let's treat her with DermaPACE.
Like Dr. Niezgoda said, the DermaPACE is acoustic therapy technology. In layman's terms, basically what we're doing is we are shocking the area of treatment with acoustic sound waves.
So the studies have shown that when you treat tissue with sound waves, you stimulate growth factors and pre-angiogenic cytokines that then develop a vasculature under the tissues, and obviously that correlates with wound healing. I believe that the sound waves actually have other benefits in addition to the pre-angiogenic cytokines. I believe there's anti-inflammatory cytokines. We have noticed a decrease in overall wound inflammation when we're treating with DermaPACE. So we'll go ahead, and this is conductive gel. Obviously, most people know that sound waves have to be conducted through a medium. This is a sterile gel that is applied. The settings, as you see right here, we're picking energy level of E2. The dose is going to be 1,000 pulses delivered at 360 pulses per minute. So about 3-minute treatment here. Very quick and efficient. Okay, John, take her away.
Okay, here we go. Let me know if you feel any pain, okay?
Now you see Jonathan is moving the probe across the wound. This is not a stationary therapy. You want those sound waves to be distributed not only across the wound base, but we're treating the peri-wound tissues as well. So he's slowly moving that probe across the base of the wound. It's a painless therapy, and Sharon, the studies have really shown very nice outcomes in the margin of diabetic foot ulcers. We've been looking at the applications, as we'll see in this next treatment, of some other wound types, and I think there will be benefits noted in, for example, pressure ulcers, venous ulcers, So you've just seen the DermaPACE used on the diabetic foot ulcer. Now again, we are looking at this therapy applications for other wound types. And so we're going to go ahead and treat this patient's pressure ulcer, and hopefully we'll bring you some interesting results on another edition of the Wound Care Window. We'll watch Jonathan again deliver the DermaPACE, energy level E2, 1,000 pulses at a pulse frequency of 360 per minute. And then after this DermaPACE therapy, we'll re-image with the Kent imaging, looking for increases in tissue oxygenation, hemoglobin saturation, correlating to tissue perfusion, which is the whole idea here, that DermaPACE is stimulating angiogenic factors in tissue perfusion. Once again, you'll notice that Jonathan is taking and treating the entire wound. He's very slowly moving that probe across the wound base, treating the wound base as well as the peri-wound tissues. You obviously do not need to treat the entire foot, just the local area of injury. So we've just treated both wounds with DermaPACE, as you observed, and what we'll now do is re-image both wounds with our near-infrared spectroscopy. And then what I'd like to do, John, is can you compare and contrast pre and post? So the images drop in very nicely just by pulling them.
Oh, wow, that's very, very nice.
You get a contrast. You get the sense that there might be a little bit of a increased oxygenation right in that area, John.
Right,
We get
yeah.
difference in numbers?
58% post DermaPACE and 44% pre DermaPACE.
So that's interesting.
So that
Very
is a little
interesting.
bit of an increase with one treatment.
Yeah.
That's
very
really
interesting.
great.
Well,
Great
Sharon,
technology.
what'd you think?
Hey, I think it's great. I'm glad you're using it, and thank you for sharing it with
Interesting
me.
stuff.
I have never seen this before, so this is really great.
Thanks again for joining us at
That's the
AZH.
news stuff. Thank you.
And thank you for joining us on this edition of the Wound Care Window.